I wanted to find out exactly what's happening inside the body. Obviously, it's been 5 years this month that the pandemic started, and people are still living with the after effects in their bodies in terms of contracting the virus. I mentioned earlier, but closer to home here in the UAE, research indicates that nearly 49% of those people that were hospitalised with COVID-19 in the UAE have experienced long COVID symptoms, with about 47% reporting that these symptoms persist for more than a year. And our previous guest, Carrie, made the point that there's obviously many people that caught COVID that weren't hospitalised, that aren't part of those figures, that may well be living with this condition as well. So why do people bounce back while others continue to suffer from the symptoms months or even years after they've been infected? Well, to help us understand the medical side of things, I'm delighted to say I'm joined by Dr. Maryam Mojtabavi. She's a diseases specialist at Medcare Royal Speciality Hospital. Dr. Maryam, thank you for coming in today.
Oh, hello. Thank you. Thank you for inviting me for this great informative program.
So I want to know, what's the current medical definition of long COVID? Like, how do you diagnose it?
There are different definitions for long COVID syndrome, but the most popular one that used by most researchers and physicians is provided by WHO, and it involves different criteria in it. The most important one is that the patient who suffers from different kind of symptoms more than 3 months after the beginning of the COVID, for at least 2 months, and there is no other explanations for these symptoms. They are defined as long COVID, and it should be significant enough to affect their daily life. So if we have some kind of these all criteria there, then we can say, okay, it's a long COVID syndrome.
Gosh, it's really not that straightforward to diagnose as you would think.
Yes, the diagnosis is the diagnosis of exclusion. It means that whatever patient complained about long COVID, we should go for it, make some explanation, do accurate and precise and detailed examinations, maybe lab tests, imagings, or other something that related to other specialties. After that, if we don't find any kind of explanation, then we can say, okay, this is a long COVID syndrome.
Okay. So what are the common symptoms, though? Someone's listening, they had COVID, they weren't hospitalised, but they don't feel like they are quite right still. What might be affecting them?
The most common symptom is the fatigue, a very severe tiredness. Most of patients complained about fatigue, and after that it's a body ache, joint pain, muscle pains, and after that respiratory symptoms are one of the most common symptoms, like breathlessness. This is very important. And then after that we have insomnia, sleep disorders, and after that some alteration in mood, something like anxiety, depression, or loss of concentration, difficulty with memories. They are among those very common symptoms we have from our patients. And other things like loss of decrease or alteration in smell or taste are another important things there.
And does a patient have to have so many of those symptoms in order to sort of cross for the barometer to get to be diagnosed with long COVID?
Yes, I think she was one of the rarest cases to experience these symptoms for more than 4 years. It's really, it's very difficult to continue life with all these symptoms for a long time. But now with these new definitions and new upcoming diagnostic tests, most of the time we can find something else in the background to find it as the thing that maybe we have some coincidences, maybe we have some previously undiagnosed conditions that this COVID thing, because of the highly stress and pressure put on the body, make them to come up. So it's important to go for an accurate, detailed diagnostic test. And if we don't find any diagnostic things, then we can go and say, okay, it's a long COVID.
So you almost have to rule out everything else before you can say it's long COVID.
Of course. Everything should be there and should be excluded.
I mean, it sounds like it's hard to diagnose for a start. It's not as simple as doing one test.
No.
Has research caught up with the condition, or are we still in those early stages of understanding it?
COVID is one of the emerging diseases. It means that we just involved it in these recent years. But unfortunately, thanks to all these studies have been conducted all around the world, our knowledge about COVID is, gradually extended, and now we know many things about COVID. But still, we are in the first stages of the completing our knowledge, and we need more time to make it. But from all these studies have been done, I think that we know very in detail things about it, but we have a long way to make a complete understanding about the physiology, about the diagnosis, and about the treatment of COVID itself, and all complications maybe come with it.
I heard from our previous guest, Carrie. She went to alternative therapies to help with her symptoms and to cure her. I'm saying that in inverted commas. What treatments are you using to help patients?
Treatment are completely symptomatic in our side. We go for the symptoms. We find what kind of difficulties our patient face, and then we go for it to treat them one by one. It means that some of patients really suffer from depression and anxieties because the experience of COVID, a long time staying in bed, different kind of medication, make them something that it's sometimes like a PTSD condition, post-traumatic stress disorder. That's much high pressure put on the soul. So it means that if somebody like the story we have, maybe help from psychiatric side, maybe help, or if we find something else in the activities, rehabilitative medicine can help there, something like physiotherapy, something like work rehabilitation, all things according to the what kind of symptoms the patient experience, we can provide and we can offer to relieve the pain and help the patient to go back to the normal life.
How many patients are you seeing a week, Dr. Maryam, like new patients with these conditions?
For COVID now, the policies are changed after 2024 when the pandemic declared that it's finished. And nowadays, we have less patients because the pandemic is under control now. So, we face some patients suffer from these, symptoms. But, according to the definition of what WHO provided for us, it's a little bit difficult, it's a bit, tricky to make exact diagnosis. Is it the post-COVID syndrome? Is it correct one? Because it should take a long time. 3 months, and then at least for 2 months after that, and no explanation. In most cases, we can find something there, and we can go for it and to treat it, and it will help patients too much.
It really isn't straightforward, though, is it? I mean, how frustrating as a doctor must it be to not be able to sort of treat this hands-on? Is it that we just don't know enough about it?
Would you please tell me?
Of course. Is it frustrating as a clinician
yes, of course.
to not be able to treat this?
Because we are there to help our patient. We want from the point of our heart to be helpful and to reduce the pain and to reduce what they suffer from. For us, it's a big challenge too. And that's the reason we try to evaluate it on different aspects to make sure that there is no other reason, no other explanation, and then go to symptomatic treatment. With symptomatic treatment, if it's done by an expert professional, I think people suffer less. But it's important to go for a correct one, to make a good diagnosis for them. I think this is the most important thing.
That is so fascinating. Dr. Maryam Mojtabavi, disease specialist at Medcare Royal Speciality Hospital. Thank you so much for coming on the show today and giving us your important scientific and, medical advice on long COVID condition. I want to know, are you still struggling with long COVID? You can message me. The best way is on Instagram. My name, a little bit long-winded, is _Katie_Chambers.
The Agenda on Dubai Eye 103.8.
As we heard from our previous guest, Dr. Maryam Mojtabavi, who's a disease specialist at Medcare Royal Speciality Hospital, there's a growing list of more than 200 possible symptoms for the condition. It's hard to believe, isn't it, that it's been 5 years since we entered the whole COVID realm. It just seems like an absolute... Well, in one respect, it seems like an age ago, but then in another respect, you blink and it seems like it was only yesterday. But this condition of long COVID, as we heard, is still affecting many people with them being right here in the UAE. And